Hey there, I am going live today to talk about a really fascinating thing that happens in the brain, and that's called the placebo effect. But particularly going to talk about this and dopamine and Parkinson's, because this is a whole little rabbit hole of literature actually that I probably dove into a few years ago and just kind of rediscovered. So I'm so excited to talk about this article and actually a few others and to dive into this great topic. Thank you so much for joining me live. If we haven't met, my name is Julie Hirschberg. I am a neurologic physical therapist and I'm based in the Los Angeles area. I am the owner and founder of an integrated neurologic rehabilitation center. It's called re+active Physical Therapy and Wellness. And also we have this really incredible Parkinson's program. We're doing a masterclass for people with Parkinson's next week, and I've been diving into all this literature. So if you're a person with Parkinson's, by the way, you should come. It's next Tuesday, July 1st, and it'll be recorded as well. So we're going to talk about a lot of these interesting things that maybe are less talked about in Parkinson's. So let me share this article. Let's see, because I grabbed so many different articles to talk about today. I'm gonna kind of highlight two. This is a systematic review, so it goes through a bunch of articles, and there's a particular article that I just really loved within this systematic review. So this is the article, and by the way, if you are on our newsletter, I'll send out a link to both of these articles, and I will send out this recording as well. So we do that every week. So this article, and I want to get the whole thing. It's from the Movement Disorders Journal. It was from 2018. And it's called The Neurobiology of Placebo Effect in Parkinson's Disease, What We Have Learned and Where We Are Going. The main author is Quattrone. I might have pronounced that wrong, but that is the main author on the study. So I'm going to pull up the study actually here for us. And again, I have a couple of the studies, I believe out of Italy. Yes. So Italy and British Columbia is the group of the authors here. So let me stop sharing this. So why are they studying this? Why are they looking at this? And I think this is so very interesting, not just in Parkinson's, but in multiple neurologic disorders. Where it's been studied the most is in pain, depression, multiple sclerosis. As you know, I like to talk a lot about functional neurologic disorders. The placebo effect, as well as nocebo effects, have also been studied in those areas, and in those particular disorders. And it's really important when it comes to research to have a comparison and to know what that placebo effect might be. So let's talk about what is the placebo effect. And it's beyond, I think like back in the day in randomized controlled trials, it was thought of kind of like the sugar pill, right? So this was comparing, especially in research, comparing medications, that you would have a placebo controlled trial where a person might receive the medication or a quote sugar pill. But a placebo effect, as written in this article, is a beneficial clinical outcome produced by something that was inert. So the sugar pill, for example, or normal saline if it was an injection, or as they did in some of the studies described here, sham transmagnetic stimulation. So those are some examples. And that effect comes from belief, expectation, or even conditioning. And it is a very, very real phenomena. So this is one of those things that maybe even has some stigma, like, oh no, like that's in your head. No, it's actually a biological phenomena that occurs that we're going to talk about. Like, real brain changes occur with the placebo effect in Parkinson's, particularly dopamine and the use of dopamine in parts of the brain. And I've got one of the sub-studies in the systematic review has these really beautiful images, and I'll show you what that looks like. Now, this is significant in Parkinson's, and so this is what they talk about, like, why are they doing this paper? Historically, people with Parkinson's can have really high placebo response rates, up to 50% motor improvement from a placebo. This is very, very high. And I'm going to say, as a clinician that has worked with people with Parkinson's, really like my entire career, but especially in the last 13 years, heavily in the field of Parkinson's, I definitely can see this occurring. And as the authors discuss and have many people discuss, this likely has something to do with dopamine and those dopaminergic pathways in the brain that are impacted by Parkinson's. Now, I find this so very, very interesting, and I know my fellow colleagues are kind of nerding out with me on this, because there is also a strong link of Parkinson's to other disorders like functional neurologic disorder. And perhaps this dopaminergic pathway is a part of that. And it might explain the placebo effect, the effect of predictions and expectations in both disorders. So yes, we're talking about Parkinson's. Yes, this paper is about Parkinson's, but I think it has implications for a lot of what we do as clinicians. So let's talk about this article. So one of the biggest breakthroughs, so in this article, they go through some key studies where this was like first really discovered. In 2001. So this was when I was in PT school. So I graduated PT school in 2023 or 2002. Oh my gosh, I can't get my numbers right today. So I graduated in 2002. So this stuff was not stuff I was taught in school, for sure. It was brand new. There was a study by De La Fuente Fernandez, and this study showed that a placebo injection led to dopamine release in the striatum, in that part of the brain that is impacted by Parkinson's. That was kind of the first study. Now, I will say, and I will send out, by the way, in our newsletter, links to these articles. This was one of the first, but there have been many. There have been many. And I do want to, I am going to show, after I review this study, I want to show another study as well. But in this particular review, they talked about the results of PET scan studies. So PET imaging looks at binding of dopamine receptors. And this seminal 2001 study was done with PET scan to show this. So that was the first. There have been since been other PET scan studies. There have been fMRI studies. So again, as in any systematic review, there's tables of studies. So I'm just kind of hitting on the highlights of this. So PET scan studies, fMRI studies, single neuron recording studies, deep brain stimulation studies, and TMS studies, transmagnetic stimulation. I want to show you the graphic that they have that summarizes the response of all of these. So in Parkinson's, by the way, there are two major pathways that have been studied and looked at, along with, Parkinson's is a network disorder. It's not just a one thing disorder. But this is kind of simplified. The red pathway is the nigrostriatal pathway, and the green is the mesolimbic pathway. So what you see with these little, there's little symbols over there, those are different studies that have been done to kind of support this. So you see placebo administration to motor improvement. And there's two pathways this might occur. One is through expectation of a reward or positive reinforcement. Now we know if we want to produce dopamine, by the way, like dopamine hack right here, if you wanted to produce dopamine in the brain, having an expectation of a reward is really, really valuable. So that would be kind of like how your mouth waters before like you're waiting for a meal, right? So placebo administration with expectation of reward or positive reinforcement, what they see is in that ventral striatum, release of dopamine in the mesolimbic pathway, activation of the anterior cingulate cortex and the prefrontal cortex. This affects the dorsal striatum, so this is in the red. This releases dopamine in the nigrostriatal pathway, reduces the inhibition of the basal ganglia output, and this leads to motor improvement. So two different ways that administration of a placebo could affect that motor improvement, supported by multiple studies that show the brain actually doing this, the brain actually having these changes in these pathways. So not just the person like pretended their symptoms got better, not that they just like worked a little harder and their symptoms got better with the placebo, but no, the placebo actually caused a change in that pathway and a release of dopamine. This is so very powerful. For us as clinicians, for people that work with Parkinson's, because there's so much we can do to facilitate this. There's limitations when it comes to medication and medical management in Parkinson's. And if we can facilitate this in other ways, like by all means, I think we should do it, right? It's not playing tricks on people. It's not kind of being like, well, this is all in your head, you're just making this up. Nope. This is actually working in a really positive way to influence change in these pathways affected by Parkinson's. So I want to hone in on one of the studies that was a part of this systematic review, because it's really fascinating what they did in this study. This is a study from 2010, so this is quite a few years old at this point. Sarah Lidstone is the first author, and she also is a person that now, so she's a movement disorder neurologist, but now leads a functional neurologic disorder program in, Toronto, I believe. I hope I got my Canadian city right there. But so this study called Effects of Expectation on Placebo-Induced Dopamine Release in Parkinson's Disease. They talk about this study in the systematic review, and boy, is it interesting. So I want to pull this study up for you, and I have a couple of figures, but it's really cool what they did in this study. So they provided a placebo of levodopa. This is a common medication used in Parkinson's. And along with that, they did a PET scan to look at this binding, and they told people you have let me get these right. I think it was like 4. It was groups A, B, C, or D, right? Yeah, so A, B, C, or D. Group A, we're told there was a 25% chance that it's not a placebo. Group B was told there was a 50% chance that it was not placebo. Group C was told it was a 75% chance of not placebo. And then group D said it was 100% chance that it was not placebo. However, everybody got a placebo. So nobody got the levodopa. So I want to show you this first. This is so fascinating. Here it is. Okay, so these were the changes in the motor score of the UPDRS. So the UPDRS, the Unified Parkinson's Disease Rating Scale, is a measure of a person's Parkinsonian symptoms, essentially. So they looked at the changes pre and post this placebo trial of groups A, B, C, and D. You can see very clearly that group C, and it's got that little star because it was significant, had the biggest change. And group C was the one that was told there's a 75% chance that this is not a placebo. So that expectation, but also somewhat unknown, right, actually led to the motor changes. Now, I'm going to show you those dopaminergic changes in a second too. This also was true in the dopaminergic changes. I also want to point out, because I find this really fascinating, group D there, who expected they told them 100% chance this is non-placebo, they actually had the worst response. So the authors talk about how this unknown is actually part of the what can drive this change. So having some sort of expectation, but some sort of unknown, right? Kind of like you're gambling there. So not a guarantee, right? That shifts your expectations a lot. So this is so fascinating. Let me show you the brain scans. Oh my goodness. These were really fascinating. Now, I don't study PET scans. I don't do research. I'm not a Parkinsonian neurologist. So I want to preface with that. I do look at a lot of brain imaging, but not PET scans. So I really had to read, what are they really looking at here? So this is a parametric C-raclopride, I'm not even sure if I'm saying that right, positron emission tomographic PET. So these are PET images. And this is a patient from that group C, that group that had that 75% potential of having a non-placebo. So what you can see is their baseline, and there's two images so that you can look at the dorsal striatum at the top and the ventral striatum at the bottom. So you can see baseline, then you can see what a person looks like on medication, on levodopa, and then with the placebo. And what we're actually looking for here is less of the red. So this is what because I was well, these images E and F look less red to me. Wouldn't that be worse? But no, the less red, and I'm going to read this, a decrease in this actually shows that there's more dopamine binding. So I didn't know that. I had to read through that. So what you can see, and I'm not sure if you can see it on the tiny screen here, but essentially what the brain looks like with levodopa, what it looks like with the placebo they're about the same here. So there is an increase in dopamine release in those regions, both with the levodopa, which makes sense because that's a medication meant to do this, but also with the placebo and the expectation. So that's what's so cool about this particular study. Yeah, Trinetta, does this not blow your mind? This blows my mind. Hi, Trinetta, by the way. So Trinetta's here in the chat. Oh, wow. Yes. Oh, wow. That the placebo with a 75% expectation that it contained levodopa produced the same results as the levodopa. in both the dorsal striatum and the ventral striatum. Really, really compelling. And, you know, what the authors talk about in the discussion here, they say, these results indicate that the expectation of therapeutic benefit in Parkinson's patients can directly modulate the dopamine release in both of those pathways, the nigrostriatal and the mesolimbic pathways. And it's similar, so the placebo effect mimics the brain's response to the active drug release pattern. We can mimic the response. This is like so powerful. Mimic the response of a medication through placebo. This is so fascinating to me and so very powerful. So let's talk about this. Let's kind of summarize those pieces and let's talk about what we can do as a clinician or as a person with Parkinson's. So first, we looked at the systematic review. This particular study was one from the systematic review that showed how powerful the placebo effect is on the brain, and that it's like medicine. It mimics taking medication. And this is very powerful, and it does it in two different parts of the brain, that reward pathway, that ventral striatum, as well as the motor control pathway, the dorsal striatum. And it changes motor symptoms and dopamine. That expectation of approval of improvement really reinforces this. Now, we might have actually known that. The motor control literature tells us that it appears to be even stronger in Parkinson's. Okay, so what are these implications then for people with Parkinson's? I'll stop sharing this. I think one of the biggest things is understanding the power of your brain. I mean, look at those brain images. Look at what is possible there. Your beliefs, your expectations can greatly physically influence your symptoms. This doesn't mean it's all in your head. It's in the dopaminergic pathway, which is in your head, but you have something that you can control. Now, is this easy to control? No. And I hear this from people with Parkinson's all the time. Well, if I'm around other people with Parkinson's or in a support group, I actually feel like really depressed and not positive about my outcome. And I think, this has been for us in what we do at Reactive in our wellness programs and things, is to create a really positive community with an expectation of improvement, because we know this actually influences symptoms. It's so very powerful. And so to be in a positive community, to be around others who are making gains and changes and hope for positive changes can really change your brain. This is why we created a Parkinson's community. This is one of the reasons we do what we do. Now, it doesn't mean this is a replacement for medication, because it does actually look like this placebo effect is actually correlated to how effective the medication is. So there may be that we kind of need this preconditioning with the medication first to get the same effect. So not a medication replacement at all. But we can harness the power of this effect, the power of expectation, the power of predictions through treatment. And this is where clinicians, we can really influence this effect. And I think when I say influence, I'm like, dopamine, people were like releasing dopamine. We can influence this for our patients. It doesn't mean we're lying to them and saying, well, you're going to get better, that we're giving them something that that is fake. That's not what I'm suggesting. I'm not suggesting saying fake things or lying. I actually think it's really powerful to share some of that great evidence that we do know to give a positive expectation for improvement. The evidence of aerobic exercise, high intensity, high amplitude, high speed training, and how they affect people, and the expectation of improvement from that, right? So all of those things can really influence our outcomes for people with Parkinson's. And I think this really comes from how we're communicating with people, how we're building our, our therapeutic alliance with a person. All of that becomes a part of that. How we can create that anticipation and expectation, right? It doesn't mean that we're giving somebody something that's like 100% you're going to succeed at this, right? Because we actually saw in the study that 100%ers actually didn't get better. There was some unknown in there. And I think that's such like a powerful dopamine burst for us. So that would be another thing that we would think about in our interventions for people with Parkinson's too. So much that we can learn from these great studies. I want to encourage you to reach out with questions or just your own neuro nerdiness insights with this stuff. I love this stuff. It's so fascinating to me. If you are a person with Parkinson's, please join us next week for our live masterclass. It's on July 1st. It's a Tuesday, 5 p.m. It is live. We are going to record it, but there is a little something special that we're doing for our live folks. We're going to actually practice some of these things and do them together. And that is next week. So you can sign up. If you send me a message, I'll send you the link for it. If you're watching this video after it's been recorded and uploaded, you can comment Parkinson's and we'll send a link as well. But I'll send out the links to these articles, as well as this video in our newsletter, as I do every single week. And thank you. Thanks for being so curious about the brain with me and how we continue to help people live their best lives. So, thank you so much. Trinetta, thanks so much for coming. Trinetta says, thanks for sharing this paper. Also in uplifting the Parkinson's community. It's a game changer for patients. Absolutely. So, I hope you all have a great rest of your Thursday today, and I will see you again soon.